Hey everybody, we're going to talk now about treating foot and ankle. So pretty common dysfunctions in the clinic. You're going to have sprained ankles, you might have some tendinitises. If you're dealing with a neuropathy or a diabetic neuropathy, I'd refer you to our video that we shot specifically on that topic. That's a whole different treatment protocol. But as far as treating an ankle sprain that's swollen or a sore foot, generally very straightforward and easy to treat. I have on our large cone attachment, and you can use this to basically treat the top of the foot, the sides very easily. You'll find with bony prominences like around the malleoli, sometimes the roller ball doesn't feel great for those types of patients, especially with acute inflammation. So going off contact might work well if you're going to be on the dorsum or the medial lateral sides of the ankle. When you're dealing with the bottom of the foot, plantar fascia type problems, the ball then works really well. But as far as depth of penetration and what you're trying to address when you're dealing with the top of the foot, you don't really need the power of the ball to maximize treatment unless it's requested or you really feel like it's a perfect application. That being said, power ranges for treating the foot are going to be between 7 to 15 watts. You have some variability there. The more acute the problem is, the less power you probably want to utilize out of the first couple treatments. And dosing is going to be in the ballpark of 6 to 10 joules per centimeter squared. And the reason why there's ranges is that depending on skin tone, darker skin is going to absorb more light, so you might have to up your dosage a little bit for those problems, as well as more chronic problems tend to respond better to higher power and a little higher dose. So just put your thinking cap on as far as how acute the problem is, how much swelling you're looking at, and that should help make that decision on where you are in that range. That being said, very straightforward. If you're using our perfect protocol for area, if this is 100 centimeters squared, you're going to map out. If we're trying to treat an ankle sprain, you're going to try to get the majority of the capsule. 100, 200. If you're going to get the heel in that aspect, you might be looking at 300 centimeters squared. So you put that into this first box, 300. Power, like we said, is going to probably be somewhere in the ballpark of 7 to 15 watts, so let's call it 10 watts. And then for your dose, you're going to be in the 6 to 10 joules per centimeter square range. So let's say it's more of an acute problem, so we'll put it at 6, and then hit calculate. This treatment would take 3 minutes to deliver 1,800 joules of energy. So you make sure you have your glasses on. And hit the standby button. As far as treatment goes, you're just going to pass over the ankle, medial aspect, top of the ankle, just in a crisscross fashion. Handpiece should be off about 1 centimeter from the skin. You're just going to check with the patient every 10 to 15 seconds on temperature to make sure it's comfortable. And you're just going to maintain a pace that allows you to do that. If you then had calculated in the heel, you might have to change position a little bit to treat that area. And you're just trying to evenly distribute the treatment time around the entire area that you've calculated. For plantar fascia, the only real adjustment you're going to make is switching over to the large massage ball. And after doing so, you're just going to be treating the plantar surface. This allows you to do a little bit of soft tissue work while you treat, and a little bit of warmth on the foot, which generally feels really good for that problem. We've just seen a lot better results when people use the massage ball. Dosing for that, because you're going through some thicker tissue, is going to be higher, so 13 joules per centimeter squared is roughly where you want to be. And power, you could use anywhere from 15 up through 25 watts is what the research is supporting for that. So different problem when you're trying to deal with the plantar fascial issues. You probably also want to treat up into the calf with that as well. But again, 13 joules per centimeter squared for dose, and then power, you want to probably start at 10, and then you can work yourself all the way up towards 20 to 25 watts for those conditions, especially if it's chronic. Other than that, hopefully that helps. pretty straightforward to treat an ankle. Hopefully you'll be a pro at it after you watch this. Thanks.